Hi, Dr. Dominic here with Elite Facial Plastic Surgery. I hope you're doing well. And today I want to talk about improving the appearance of the upper eyes. If you've ever felt like your eyes are hooded or your eyes don't feel like as bright and as open as they used to be, all too often it's related to aging. And, as time goes on, we start to have descent of the upper periorbital area. Now, many times patients think that they may need a blepharoplasty or brow lift. And to be honest with you, it really depends. Everybody's anatomy is different. And what you have to assess is the entire, upper part of the face. And what you want to look at is, you want to start with the top. Look at the brow area. And many times I see patients, especially females, who think that they need to have skin removed from the upper eyelid. And in actuality, it may just be the brow. As a rule of thumb, for most women, you want the brow to be above the bony orbital rim here. And the reason why is that helps to open the eyelid complex. And that is a more characteristic feature for women. Whereas men, we normally want to be right at the brow area. Also, women compared to men, you normally want to have a little bit of an arch as well. Now with that, if you look in the mirror and you elevate your brow and you feel like your eyes look more open, then that is many times can be an indication that you need to think about a brow lift. Now, with that being said, you oftentimes have to combine upper lid blepharoplasty. And the reason why is as we age, and again, every person and patient is different, is you may have excess skin that needs to be addressed at the same time as the upper lid brow lift. In addition, there can be fat that can be herniating from these compartments of the upper eyelid. Those cannot be addressed with a brow lift. However, they can be addressed with an upper lid blepharoplasty. And doing an upper lid blepharoplasty, you're basically making an incision in the upper eyelids and you're removing skin and muscle. And then you may also need to remove some fat. With the brow, you can have different type of brow lift techniques. I'm sure many of you have heard of what's known as the endoscopic approach, where you make incisions. And normally the incision points are in the middle of the forehead, at the sides, and then over on this side as well. The other brow lift technique can be what's known as an incisional brow lift. In that incision, in my practice, I prefer to make that just behind the hairline. The benefit of doing the incisional approach is that not only are you elevating the brows, but you can remove some excess skin that's present. So it has an additional benefit of removing some excess skin, especially in those patients whose forehead is too high. So to kind of summarize, if you feel like your eyes are hooded, you often have to not only look at the upper eyes, but also look at the brow. You can think about doing a brow lift, or you can think about doing an upper lid blepharoplasty at the same time. You can certainly opt to just do the brow lift and later on address your eyes. You don't have to do everything at once. And I tell all my patients that you can always do more down the road. My advice would be though, is if you need both procedures, do the brow lift first, and then down the road, you can think about doing the upper lids at a second procedure. So I hope to shed some light on the appearance of the eyes when they become hooded and tired appearing. Please check out our channel on YouTube, where I'm also uploading videos to kind of illustrate what we're discussing. Have a great week.